Okay, hello everyone. So we are on live
Hello.
now. Hello, good afternoon or good afternoon, 4 o'clock now. Today we got Feng. Today we got
Hello.
Feng from Your Physio. Hello, Feng.
Hello,
So
Zia.
today we have a guest from Your Physio. So people will, anyway, so we wait for eyeball first lah. Okay, so we are
Okay.
looking at eyeballs.
Yes.
So okay, so maybe our audience will be weird, right? How come today BENPHYSIO and Your Physio sits together?
We
Okay,
collaborate.
so yeah, some secret lah. Okay, so actually basically uh we are doing some merging. Okay, some business merging process. Okay, so Your Physio equals to BENPHYSIO equals to Your Physio. Okay, so that's why
Wow.
yeah, so actually we are a big family now.
Yes.
Okay, so Feng, today you're going to share with us about Sciatica, isn't it?
Sciatica. Yes. Yes.
Yeah, Sciatica, right? So I think Sciatica is a very, very common problems, very
Condition.
common
Yes.
problems. Yes, yes. And the biggest challenge is when the mummies, when they are in the pregnancy.
Yes.
Okay,
They will.
so because the baby is there, all right, and it will increase the burden at the spine, isn't it?
Yes, and they can't
Ye-
do very invasive treatment. All that.
Yes, yes, yes.
Mm.
So some of the mother will say, "Oh, I have to bear the pain for another 3 months lah, 4 months,
Ah.
5 months lah." Yeah, but something can be done, isn't it?
Yes. Yes.
Yeah, something can be done. All right. So of course, who see physio law, something can be done, right?
Yes.
Yeah. Okay. Hello, Vivian. Hello, Alfonsa Chu. See you again, Vivian, coffee girl. Okay. So today we're not going to talk about coffee. Okay, so for audience, if you are around, if you are here, comment +1, comment Jia if you are watching us, let us know you are here so that we can talk to you. Okay, so I think Feng, shall we start?
Yeah.
Okay, so let's
Okay.
go. So okay, everyone, welcome to our live today. So today we are still under the women's health topic. Okay, so the reason why we are still having this women's health topic because month of June and July, so we have Parents' Days, okay, Father's Days, Mother's Day. So and this round we are talking more about women's health and the sciatica symptoms, okay, or it's a type of nerve pain. All right, and very fortunate that we have Feng Lai Yu Feng, okay, we call her Feng from Your Physio.
Yeah. Thank you.
Yes. Okay. So okay, let's start.
Okay. Let's start.
Mm.
Okay. So today I'm going to talk about sciatica, a very quite common condition lah. Not only in female, but male also will be having this problem. Okay.
Yes.
So today we will talk about these few topics. What is sciatica, the symptom, causes, some pregnancy related sciatica, what can we do, special tests that you can test at home, find out if you're having any problem, and then some home exercise that you can do at home. Okay,
Yes. Yes. And
so
of course,
let's
Feng will throw us a question, right?
yes,
Yeah,
I'll
Feng
do
will
the
throw us
question.
question. Yes, and
Mm.
then we have to answer it correctly. Wrong, if you answer wrong, no gift, isn't it? So we have to
Yes.
answer it correctly, and then we will have a lucky draw. Yes. Okay. So for the winner, you will win a physiotherapy
One
session.
treatment.
All right, in Your
Yes.
Physio. Yes.
Mm.
Okay, I'm correct, Mm.
Yes.
Okay, yes. So basically, Feng, so what is sciatica, Feng? Can you tell
So
us a little bit
sciatica
more?
is one of the nerve. Sciatica is caused by a nerve irritation, which called sciatic nerve. Is the biggest, largest
Mm.
nerve in our body. So it composed of L4 until S3 nerve. So it's quite a big nerve in our body. So once it's irritated, it's injured, it will cause more problem from our hip until our leg. So the problem will
Mm.
be like this. Mm.
Mm. So it's a sciatic nerve involved, sciatic nerve compress, and the pain
Yes.
starts from the pelvic hip and runs all the way
Until
down to the leg.
yes.
Yes. Okay.
Okay. So
Oops.
we go on to the symptom, like what kind of
Symptoms.
symptom you will see. Yes. So
Yes.
normally, is one-sided leg pain, and then some patient will come with back pain and leg pain, but the butt and leg pain will be more compared to the back pain. So in the sciatica, and then the pain, like I said just now, will radiate from the buttock until the foot or knee, depends on the severity. And then because it's nerve, so you will feel numbness and then altered sensation of the leg. So some will feel like, wow, the whole leg is very cold, like even sitting in a warm room, the whole leg like very cold like that. So this is one of the symptoms. And then it will cause slowly it will cause also muscle weakness that affect our gait. So some patient will come with limping gait. They limp one side to reduce the pressure
very
on
typical.
the pain. Yes,
very typical sciatica pain. Yep.
Yes. And then some will be posture-induced symptom, like when they sit down for a long time, then straight away the radiate pain will come. Or when they stand up from a sitting position, they will also feel the radiate symptom.
Yes. So actually, basically, those symptoms are definitely those audience, you already have pain. So if the pain is running down from your butt or the hip and all the way down to your legs, confirm already, right? Sciatica, most likely, Okay, so that's where you can seek for physio already. Okay, now though for those who has no symptoms, but maybe on and off you got ache and pain one, okay, stay tuned. We will teach you how to test yourself. Correct, right?
Yes.
Yeah. Okay, and then for those who on and off also feel some numbness one, also stay tuned. Okay, because Feng going to teach us how to test your sciatic nerve. All right.
Yes.
And then when it come to so when it come to worst scenario, your muscle start to have wasted lah, muscle become lembek lah, right?
Yes.
Okay. And yes, okay. So again, so for those who are in pain already one, yes, okay, feel free to call us. Correct or not? You can look for your physio, Feng. You can look for BENPHYSIO as well. Correct?
Yes. Yes.
Okay. So now Feng going to share with us what are the causes,
Yes. So these are the few causes, like the common causes. So sleep is very common recently because of the computer work a lot. Okay, so sleep is like when we sit very long time for a same position, then the tension will accumulate at our lower back. So sometimes when we don't have a strong core or strong muscle, then the disc will slowly bulge out. So this is what we call this. And then the second degenerative disc disease is like when you are aging, then slowly the disc become thinner and thinner, then it will compress our sciatic nerve also. Okay, so one more is bone spur, which is related to the degenerative disc disease. So when we have the thinner disc, so our bone will always have some friction with each other. Then slowly the injuries will cause some bone growth and bone spur.
Yep.
Okay,
so maybe
when
I
the bone spur,
jog a little bit.
Yes.
You finish first.
So when the bone spur is nearer to the nerve, then it will pinch the nerve also.
Yes. So for those who have been following our BENPHYSIO live, right? Now I think during our second live, right? So we always congrats for those who have bone spur. Why? Because we say good, congratulations, because you are still living, you are still alive. That's why you got the bone spur. Because bone spur actually is a healing process of your bone. But because of a degeneration, right? It's a wear and tear process. Yeah. All right. Yep. Okay. Feng, go back to you.
Okay. So other than the disc problem, so our muscle will also cause impingement at our nerve, at our sciatic nerve. So some of the common muscle that will impinge is one is our hip flexor. So when we flex our hip up, that muscle, and our piriformis muscle, which is our butt muscle. So these two muscle is the main muscle that will cause spasm and then compress at our nerve. So when we sit for very long time, then the muscle become very tight and very spasm, then it will cause the same symptom also.
Yep.
Okay, so next is sacroiliac joint is our lower back joint. So except there's 2 points at the beside of our lumbar joint. So this is related to our sciatica problem also, because it's related to our lumbar. So when our lumbar become very stiff or very having any pain, then it will affect our pelvic movement also. So when our pelvic movement is not very good, it's very stiff also, it will also indirectly impinge our nerve.
Yep,
Okay,
sacral iliac joint.
Yes. So one more, fracture in lumbar spine and sacrum bone is less common, but it's more common in geriatric patient, older age patient. So when they fall, they tend to sit down on their bone, and then they will have fracture because their bone is compared to younger person is more fragile.
Yes.
So next one is mainly on women. So during pregnancy, it's very common to see sciatica, especially during the 3rd trimester. End of the 2nd trimester or starting of the 3rd trimester is the most common period for them to having the sciatica problem.
Yes.
And then go back to just now, sedentary lifestyle, like very weak overall core and muscle, poor working sitting posture will also cause all this problem.
Yes. So maybe I can add on, right? The poor working posture. Now, guys, listen here, right? The guys always like to put a lot of money in the cash notes, right, in the wallet. So where do they put their wallet normally? You see, that's why ladies always got a good problem. They have handbags, okay? But guys always put the money in the wallet. So where do they put the wallet? They put it in the pocket, right? So now when they sit into the car, they sit in the office, they leave the wallet in the pocket. Now all this also will change your so-called your pelvic level, your spine level, right? Because of the big wallet, I know you have a lot of cash, right? Yeah, and that's again, it will cause all this piriformis syndrome, sciatica. Okay, actually, for everyone information, right? Piriformis syndrome, also known as police traffic syndrome. They also known as police traffic syndrome because of the thick wallet. Okay, thick wallet, and they always sit on it. So for guys, if you have a very thick wallet, a lot of cash, what do? Give it to us. Okay, don't put inside a wallet and sit on it. Correct? Phong. Okay. Okay. So yeah. Okay. So actually, basically for those causes right now, for audience, today we are talking about sciatica. Okay, sciatica, which means it's a sciatic nerve impingement. So now there are many causes. For example, as what Feng shared with us, slip disc, okay, degenerative disc or darkening disc, right? And then a bone spur. But then, okay, now when you come to physio, right? So you ask, hey, Feng, can you push my disc in? Okay, or Feng, or how you want to remove my spur? Because my doctor tells me it's spur causing my sciatica nerve, right? So actually, a lot of times it was because of your posture, muscle stiffness, and causes the compression. Correct, right? Yeah. So this is how our physio will help you. Correct, Okay, so this is our physio will help you improve your posture, loosen the stiff muscles, all right, so that it does not compress on your sciatic nerve. Okay. Hello. Feng, are you still there? Feng, are you still there? Oh, okay. Our speaker disappeared already. Okay, maybe she was trying to go away to look for a real patient for sciatic nerve. Okay, so while we're waiting for Feng, okay, maybe we can talk a little bit more about the sciatica. Okay, now we often see a lot of pregnant ladies, right? Okay, pregnant ladies. So when we say pregnant ladies, we literally see the tummy is growing. Okay, so hold on. Hello, Feng, you're back. Hello, Feng. Hey, hello.
Hi,
hey, no worry.
sorry.
Okay, so I was talking, not you. Okay, so I'm talking about the pregnancy. All right, now, just for everyone's knowledge right now, there are some people who, even though you have baby in your tummy, and you do have some sciatica symptoms, now a lot of people will rather lie down on the bed and rest. Okay, now trust me, okay, trust us, physio. Do come and see us because we can manage you. We can help you. Of course, we can help you to manage your symptoms and you don't need to suffer and rest on the bed only. Okay, so this is our point. Why today we want to bring up because a lot of, especially a lot of Chinese mentality, right? That oh, I cannot go for uru anymore. I cannot go for physio anymore. Actually, it's wrong. You are in pain. All right. So therefore, you come for physio to get rid of your pain. All right. Of course, you may not get 100%, but at least you get 80 to 90%. Okay, relief and maintain it until the baby is delivered. Why cannot 100%? Because one of the hip muscles your baby is blocking already, so we cannot enter. Okay. So again, my sincere advice is yes, even though your pregnancy 38 weeks, 39 weeks, yes, you still can come for physio to treat your sciatica. Yes, okay, something can be done.
Still can.
Yes, still can. Yes. Okay. So next, so we want to talk about some myth and the facts of sciatica.
Okay. So and some facts. So sciatica very common is when they have this problem, they will stop exercising. They will go to bed rest for a few weeks to overcome the sciatica.
Yes.
They thought more rest, then the sciatic symptom will go off, but it's wrong. Okay, so you need to get rest, but it's not like total bed rest all the time. So you still need to stay active. So why we need to stay active is because when we bed rest for a long time, our muscle
Hey, sorry, Feng, we can't hear you.
become.
Sorry, Feng, we can't hear you. I think Feng's connection got some problem. Hello. Yeah, she disappeared again. Okay, so maybe I just help her a little bit. Just continue what she was saying lah. So a lot of people thought, hey, I have sciatica, so I might as well stop. Okay, stop exercising. Okay, and just totally bed rest. This is a very discouraging lah. So you are. Hold on. Okay, so it's very discouraging if you have to total rest on bed rest only on the bed. Okay, so that's why our sincere is despite your big tummy, okay, you still can come and then again you still can continue to exercise. Okay, I have you to add on already, Feng. So you still can continue to exercise. Okay, it's just that during the exercise, if one of the movement or one of the exercise make you feel more sciatica pain, okay, then yes, okay, you stop that exercise. Am I right, Feng? Hello, Feng.
Yes.
Yes. Okay. Okay. Second sentence, yours.
Okay. The line not here not good.
Yeah.
Okay.
Can this.
So we go to the second myth. Okay, so the second one is some of the people will only think that sciatica only affect like those old people, sedentary people, those who didn't
Hey, I think Feng, your line is very poor, leh. Hello, Feng. You're going to disappear again. Hi, Feng. Okay, maybe I just help her a little bit. So while waiting for her to find the correct connection. All right, so a lot of people were thought that sciatica only affects sedentary. Actually, it's not. It affects you from young age to old age, from female to male, okay, from kids to old. All right, so it affects anyone, okay, especially guys if you have a wallet one, okay, it's not necessarily only sedentary. Now, I'm a very active. I always do stretchings, okay. Do I also have the problem? Will I also suffer problem? The answer is yes. Okay, because sciatica is because of a unilateral compression. All right, so you have to know. Okay, you have to know. You have to know what is your problem and what are the movements that cause your this nerve compression. Hi Feng. So I have you to elaborate your second point already. Okay, you want to tell us the facts? Hey Feng, we can't hear you, Feng. Hello, Feng. Feng, we still can't hear you. Hold on, everyone. So, okay, so let me continue with the. Okay. So what is the facts? So actually, even though you are having sciatica, right? So always stays active. Stay active in the way, stay in the movement or stay in the exercise that give you a relief. Especially if you, for example, if you find that, hey, I do this movement, I feel relief. Please continue. All right. Okay. So whatever movement that help you give you a relief run, that is your answer. Now remember the point. All right. Remember the point. If that movements give you a relief, always inform your physiotherapist when you go and see them. Oh, okay. Always remember to tell your physiotherapist, hey, physiotherapy, hey, Feng, hey, I do this movement, I feel much better. At this movement, I feel more pain. All right, because all this feedback from you, right, will give your physio an input on how to help you to get better. Feng, are you around?
Yes.
Okay, good. Now I already elaborated your first fact. Now, second fact.
Okay, so same thing like what I said just now. So sometimes those people who are active in running, jogging, gym, weight training, also they might have all these sciatica symptoms.
Yes.
Not only those like old people
Yes.
or
Yes.
not exercise, but
Yes.
those who are active will also have this problem.
Yes, correct. So okay, so these are the myth and the facts. Okay, now let's look into a pregnancy related sciatica. Okay.
Yeah, so during pregnancy, like I said just now, the third trimester will be the most obvious symptom that you feel on that time. So why is it causing sciatica for a woman when they are pregnant is few factors lah. One is because of the first main factor will be their hormone changes. So during the last semester, their hormone changes will be the most drastic one because they are
Yes,
about to
baby is
deliver
coming.
their baby. Yes,
Yes, baby is out
So
soon.
yes, that's why the pain will become more intense during the third trimester. There's a hormone we call relaxin, which help us to loosen up the ligaments and muscles so that the baby can come out easier. So during this third trimester, this hormone will be the most active one. Okay, so
Yes.
by that time, your joint will be very lax, very flexible, and then because of that, your muscle also become very weak, and then poor posture will develop, like what previous
Yes.
FB live you mentioned. Yeah. So some of the less common factor will be the position of the growing baby is not good that until the nerve is being compressed.
Yes.
So roughly 50 to 80% of pregnant women will experience sciatica at their pregnant period somehow at some moment.
Yes, yes, yes. So of course, as a physiotherapist, yes, we do encounter many. Okay, and there's a problem. So they will call us, hey, I'm at the third pregnancy, third trimester, right? Do you think I still can come? So I always tell them, yes, why not? Okay, we still can help you to ease your pain. At least you still can manage it until your baby is out. Yeah, something still can be done. Yes, okay, because okay, everyone, if you never ever have a sciatica pain right now, let me tell you, how is that? How does it feel like? Okay, imagine every day you are sitting on a knife. You're sitting on a knife, okay, or you're having a knife in your leg. That is sciatica pain. Okay. So again, so don't let the knife cut you. Come and see us so that we can help you to remove the knife.
Yes.
Okay.
Okay.
Yep.
So like I said just now, so
Yep.
for the position of the baby, you can see the head is directly on the sciatic nerve.
Sciatic
So
nerve.
during the third trimester, the baby will become bigger and bigger and bigger. So the pressure will be more. So the pain also will increase. So third trimester, no problem. You still can come and see us.
So
We can help you to relieve.
yes. So Feng, later is it your question will be, so who is the culprit for sciatic nerve? Is it baby? No, right? You're not going to talk about that.
No. For
Okay.
men, no baby.
Yep. Oh
Okay.
yeah, men no baby. Oh yeah, you're right. You reminded me. Okay, so Feng, you're going to teach us, right, how to test ourselves, self-test.
Yes. So there's two tests. One is that we can test by ourselves. The second one is you need to test with other people helping you lah.
Okay.
Okay. So the first one you can see
The
we
first one.
call slump test. Okay. So you can see is sitting on there. Okay. Let me move a bit. Okay. So you just sit. Okay. Then you need to slouch.
Okay. Slouch. Okay.
At the back. So when first you slouch,
Okay.
you already feel some lower back pain. Means your problem starts from your lower back.
Okay.
Okay. So when you point your neck down, next step, neck down. Okay. Slouch, neck down. If the tension become more, means your problem also involve your neck, your cervical spine.
Yes.
Okay. So the last one is you need to straighten your knee and then flex your toe towards yourself. So
straighten the knee and flex the toes.
Yes. So for sciatica, the most obvious symptom will come when you extend your knee, straighten your knee, and your toe point to yourself. You will feel intense pain coming up.
Yes. Okay.
Yes. So you test for both of your leg. So if the one you start with the normal one first, you feel like it's normal, I don't feel much. Okay, then you go for the pain leg, it will come with intense pain compared to the other leg.
Yes. So actually, everyone, this is a very sensitive test. Do it carefully if you are having sciatica, because it may reproduce your pain. Yeah. Okay. Then again, if you reproduce your pain, yes. Yes. Okay. Yep.
So no sudden movement, no jerking movement.
Yep. Okay. Do it gentle, slowly.
Yes. Okay. So I think do one time already, you can feel the
tension.
Reproducing the pain already. So you no need to repeat like 2-3 times to test like, is it confirmed that I having sciatica?
Yes, yes. Okay, so everyone, summary. This is a test whereby there are few steps. Start with your slouch, and then your head look down, and then your knee extend, and then points your toes upward. Now, if any of the position reproduce your pain, confirm. One time confirm already, right, Feng?
Yes,
yeah.
yes. It's
Okay,
a very
confirm
sensitive
sciatica. Okay, and then you can come already. You can call us and come already.
Yes.
Okay, good. Yes. All right.
Okay. So next
Okay.
one is you lie down. Okay. So you lie down, face up. Then someone will help you to carry your leg up. Okay.
Yes.
So
yes.
you are totally relaxed. Okay. So roughly lift the leg until 40 to 50 degree. Then you will start to feel the symptom. So this way. but I don't have someone to help me carry. So it's until this way. Then you point
the toes upward. So if everyone can't hear her, never mind. You lift up your leg, all right, and then point your toes upward. Oh, she disappeared again. So you lift someone to slowly lift up your leg, and then you point upward. So now same feeling. If you have reproduced, if you reproduce your pain, then confirm. All right, you are having sciatica as well. So actually, for everyone, for your knowledge, this is the test that normally orthopedic does at home, in a hospital. So okay, Feng, I already helped you to explain that whenever you lift up the leg and points the toes upward, right? Okay, the moment you felt the pain, all right, that is called sciatica positive test. Yes, and this is the common test that orthopedic does at home, that help again. That's in a hospital to test someone with sciatica pain. Yes, and because this is a very sensitive test actually. Yes, sensitive in a way, quite high accuracy lah. Okay, so everyone, today we have learned 2 tests. All right, either slump test or one is we call SLR test, straight leg raise test. All right, this test is to test out if we have a sciatic nerve problem. Okay, so next, okay, Feng, are you going to teach us how to relieve our nerve tension? Alamak, Feng gone away again. Feng's internet very, very poor. Hello, Feng. Wait, I remove her a little bit. So now we know there is a sciatic nerve problem. Okay, sciatic nerve is our biggest nerve in our body. All right, and it arises from our low back. Okay, go all the way and it travels all the way until our toes. Okay, so when the sciatic nerve is in trouble, it will give us pain, numbness. Okay, all the way down to the leg. Okay, and for everyone's knowledge, sciatica normally happens only one leg, not both legs. Feng, you are back. Okay, Feng.
Okay, so this is the exercise to reduce the tension at our nerve. So when our nerve is very irritated, so it will become very tense. So this exercise help you to reduce the tension at the nerve so that it can help you to reduce the symptom also. Okay, so there's 2 ways you can do this exercise, in lying down or sitting. Okay, so I will show you the lying down first. Okay, so normally just lie down. Okay, then you just do it for the leg that you feel pain. Okay, so you just hug it. Okay, then you straighten. Relax.
And then you put it down again. All right.
Yes, then relax.
And then put it down again. Yes. Okay. All right. So everyone, you are holding your pain leg. Yes. Oh, thanks, Feng, running here and there.
Yes, only the pain leg.
Pain leg, yes. So when you straighten, okay, you straighten until the feeling of pain, then you stays there, and then you put down, right? You don't force yourself. Don't need to forcefully go right beyond the pain. Yeah. Okay. So you extend the knee, straighten. The moment you feel the pull, then let go, and then come again. Repeat. How many times to repeat, Feng? Feng, we can't hear you.
Can do 2 times, maximum 15 times.
10 to 15 times. Right, Feng, 10 to 15 times.
Yes.
Okay, 10 to 15. That means what? I straighten, put down 1 time, straighten, put down 2 times.
Like, let's say the pain.
The pain should reduce as we repeat. All right. Now, if your pain is exaggerated, please stop this exercise. Okay. So
Yes,
do it at home
yes.
carefully.
The symptom.
If it if it aggravated your pain, stop. If it reduces your pain, continue. All right. Exercise is meant to make you better. It's not meant to make you more pain, everyone. Okay? Yep. So you also want to teach us how to do in
Yes,
sitting, right?
no increase in pain.
Yes, no increase in pain. All exercise, no
Yes.
increase in pain.
So sitting, you can see the movement. So it's, yep, no increase in pain. So the sitting is like the slump test that we do just now. Okay. So we slouch our body, our hand put at the back. So this time our leg, when we straighten our leg, our neck will follow. Okay. So it's this way. Okay, let me get a chair. Okay.
Wait, we try to see Feng. Oops, cannot. I'm sorry, Feng. Feng, can you demo one more time? Feng, can you demo one more time? Hey, our Feng missing already. Yep, Feng.
Yeah, can you hear me?
Yes, yes. Okay, can you demo one more time? Sorry.
Oh. Okay, so we sit on the chair. Okay, so we slouch, hand at the back. So when we straighten our leg, our neck follow up.
So when you straighten your leg,
so
your neck go backward.
Our neck will follow down. So
Understand? So leg up,
yes.
head up.
Okay.
Leg down,
When
head
we
down.
look down, our leg also down.
Understand?
So
Okay. Okay. Knee up,
yep.
head up. Knee down, head down. Okay. Okay. So this is again we call it nerve gliding. All right. Now everyone, nerve is a non-stretchable tissue. So therefore we don't stretch the nerve. Okay, but we glide our nerve. Glide means we make it move. Okay, we move the nerve inside. Okay. Yep. So that's a good one. Okay. So okay, next. Okay, any other home exercise? Oh, okay, we got some. Okay, Feng? Hello, Feng. Okay, so basically, right, this home exercise, okay, now, everyone, if you know, right, if you have low back pain or if you're having sciatica, it doesn't mean that it's your back problem. Okay, it does not mean it's a back problem. Now, for our clients who have been with us, BENPHYSIO and your physio, right, you all will know. We will always try to educate you all that back pain does not come because of the back problem. All right, back pain doesn't mean that we just need to treat your back. Actually, because a lot of times, again, 100% of your time, it is because of the hip muscles. Okay, it is because of the hip muscle. Okay, so now these are the three exercise that you can do at home. Okay, I mean it's quite a simple exercise, but you need a yoga mat. All right, so there's some exercise that you can do at home to stretch your front thighs muscles. Okay, to stretch your front thighs muscles. All right, so again I repeat, back pain is not because of back. Okay, pain is not because of back. Many times it was because of your hip muscles. Hip muscle, which is your front thighs muscle. Okay, if you don't know where is front thigh, this is the thighs muscles. All right, and now these three photos in the picture now are the muscles. Okay, are the stretchings. Okay, to stretch the front thighs muscle. All right, which is you have to do it on the floor lah. And then because it's a little bit painful if you do it with without anything, so it's best if you can put a yoga mat. All right, it's best if you can put a yoga mat or some cushion to cushion your kneecap. Okay. So okay, so these are the three home exercise that you can do at home. Okay, and okay, so now for those who used or not to use, for those who do follow our Facebook Live last week, if you remember Michael Jackson dance, okay, so if you remember Michael Jackson dance, now the first one is a video. The first one on your left is a video. So now that video will teach you, okay, it's asking you, okay, to do the Michael Jackson dance in lying down. Okay, now reason very simple. Okay, if you can't do the Michael Jackson dance in standing, okay, the best position to start with is in lying down. Okay, in this lying down on the floor with your legs bent. All right, same thing. Those who always have back pain, right? Lying down on the floor with bending the legs is the most comfortable one. Okay, so you can start with this position first, lying down, and then try slowly to do the Michael Jackson action or movement, so that you try to flatten your back on the floor. All right, it will give you a relief. Okay, it will give you a relief. Okay, so and then we have one exercise on your right hand side. Okay, Feng, you're back.
Hi.
Okay, so we have one exercise. Yeah, so we have one exercise on the right hand side. All right, so now just now we talk about a small muscle, we call it piriformis muscle, right? So Feng, you're going to teach us how to stretch the piriformis, isn't it?
Yes.
Yeah. Okay. Now your time.
Yeah.
Okay.
So we normally office hour also we can do this exercise. So we both leg on the floor, okay. Then one leg bend, okay. Just like your crossing leg. Then you bend in front
your body
until your finger can touch the floor.
Okay. So what we should feel is that, okay, again, we are doing exercise for your sciatica leg. Okay, we are doing exercise for your sciatica leg. So therefore, this should be performed on your sciatica nerve, sciatica leg. Okay, so cross your pain leg and bend forward. All right, until you feel some pain, some stretch, comfortable pain at your bum, at the bum side.
Until touch.
Yes, until you touch the floor. Okay, and you should feel some bum pain, bum's pain. Okay. All right, Feng, you disconnected again. Yep. Okay, Feng. I think okay. So for those who already try semester, right? Okay, first trimester normally no issue lah. Second trimester or third trimester, right? Now sometimes you may want to look for some most relaxation position for yourself as well as your baby. All right, now these are few top positions that you can try. Okay, these are few positions that you can try. Okay, now position number one, what I call in the yoga we call it child pose. All right, position number two, you can lean on the gym ball, or even position number three, cat and camel pose. Now, so all these, right? If you notice, right, they are all talking about the same thing, right? Whereby you are facing downward, okay, and then you just try to play with your pelvic, all right, or Michael Jackson, okay, in the position, so that it can give you some relief at your low back. Oh. So these are the three positions that we can propose to you, especially for those who have baby. All right, because these three do help you to give some relief at your low back. All right, and so same thing for those who have babies one. Now, if you look at the, okay, how to rest yourself, Now, these are some small tips, okay, to rest yourself, especially when your baby or tummy is growing bigger in the tummy. All right, we discourage mummies to lie down flat on the floor anymore, because why? This will cause more compression on your sciatica nerve. If everyone still remember, just now we were saying the baby's head is now sitting on your sciatic nerve. All right, so it's best not to lie down flat. So we always encourage lying down on your side. Okay, now if you say, "Yo, Ben, I can't lie down side and sleep," or how? Okay, if really that case happen, now what you can do is you lie down flat on your back and you put your legs high enough on something. Okay, but again, this is not very encouraged because again, it will still cause some discomfort as well. Okay, so the best always for a mother pregnant with baby is always lie down on your side. Okay, then okay, and for mummies, you always will have some swelling legs, isn't it? So the swollen legs, okay, best also if you can elevate your legs a little bit. Wait, phone is coming in. Okay, elevate legs a little bit. So the first photo also good to help you to elevate your leg and control your swelling. Okay, so Feng, I have helped you to cover the education part. Okay, so lying down sideways is always best for a mommy. Okay, yep. Okay, you want to talk about the ergonomic a little bit? Yes.
Yeah, can you hear me?
Yes, yes. Proceed.
Okay, so yeah, so for the working ergonomics is helpful for not only women, men also. As long as they're using a lot of computers, then they need to be aware of all this. Okay, so make sure when you're sitting, your back is having a back support. Okay, so don't always sit too in front of the chair. The chair got big space, but you only sit half of it. Okay, so you tend to slouch a lot, which is not good for your back. And then for your hand, you need to make sure the table is not too high for you, or you can adjust the chair until your hand is 90 degree. Okay, so this is the best position to help you prevent your body going too in front or too back. Okay, and then if can, your computer will be eye level with your so your computer will you can access your computer at your eye level, so not too low or not too high. Okay, and then another one is when
yes, so,
yes, when you're sitting,
so
your
the
leg
monitor
is not
in front of the eye level.
Yes, so your leg is not hanging. Okay, make sure and some small cushion is underneath your leg. Okay, this will help to reduce
and one more
tension
thing.
at our back. So yes.
Remove your wallet from your pocket.
Yes.
Remove your wallet from your pocket.
Yes.
Yep, that one is important, especially for the guys.
Mm.
Okay, so breastfeeding position.
Yes. So for the breastfeeding position is very important, especially after delivery. So good breastfeeding position help them to recover from their sciatica or prevent sciatica more. Okay. So first, same thing like working, we need to have good back support. Okay, then our feet also need to be supported, especially after delivery. Our body still recovering, and then our might have some leg swelling there. So if we keep on hanging, it's not good for our leg. Okay, and then bring your baby close to your body. Don't always breastfeeding far away. You need to use more strength when the things is further away from you. Yes.
Baby is away, yeah. And I also saw that there's a pillows, right?
Yeah, so you use one pillow supporting. Yes, you won't use so much strength.
Yes, yes. So in a way, when breastfeed in this sitting position, you need pillows and then you need some small stool, okay, to support your legs. All right?
Yeah.
Yep.
Yes.
Okay. Good, good, good. All right. Okay. Yeah. So we come to the end.
Question power.
Yes. Okay. So whoever have any questions, yes, Mr. Marcus, I love watching this sharing. Thank you, Mr. Marcus. So, Mr. Marcus, hope you get something. Oh, I see Razia, Kwan, Chen Yi. Okay, everyone, thank you for following us. Mei Song. Okay, I think so far no question. Now, so sorry if our connection a little bit lag today.
Yeah.
Okay. Yeah. So now, if there is no question, then Feng, you have question for us, isn't it?
Yes.
Yes. Okay. Go. What is your question for today?
Okay. If you can answer this question, then you can get.
Yep. So you can get 1 free physiotherapy sessions at your physio Kepong.
Yes.
Yes. Go Shukiat. Okay. Thank you.
So.
All right. Yep.
Okay. Listen to this question. So when we have sciatica, do we need to straight away bed rest and stop all our activities?
I think the answer is this. Okay. So can you repeat again? Can you repeat one more time? Okay,
so
the question for today.
When we have sciatica, do we need to stop our activities and rest for the rest of the day?
Okay, so everyone tag 3 friends, okay, and give us the correct answer, okay? Tag 3 friends and give us the correct answer. Okay, so now I think there's one question Marcus Lowe is asking, can we sit with our legs crossed? Can we sit with our legs crossed? Okay, because hold on.
Yes.
Okay, Marcus, what you mean legs crossed means it's a 2 legs, huh? No, I think she was saying it's a lotus sit, leg cross.
Oh, okay.
Okay.
So if
So what
it's
do you think?
lotus, okay. So let's say if you are sitting long for this position and it's triggering your pain, then you need to avoid this. It's not good for your nerve.
Yes. How about
And then
one leg cross?
One leg cross is also not recommended because you are like the wallet one. You're putting one pressure at one side, one more pressure at one side. So it's not recommended also. So the good one is don't put on the floor.
Yes. All right. Yes. Okay. So I just to add on a little bit, Marcus Lowe. So yes, legs crossed with both legs, because of your grammar is using LEGS both. So I assume you're talking about both legs crossed. So yes, if you're comfortable, why not? Okay, if you're comfortable, why not? All right. But if one single leg cross, now a lot of people have the habit of single leg cross. So now when there's a single leg cross, you may feel comfortable. Okay, but it's telling us that something is wrong. That's why you like to cross one leg. Yeah, and Marcus says she crossed one leg on the chair and one leaning on one side. This definitely koyak already lah. Okay, so yeah, this one definitely koyak. Marcus, you please come make appointment already. I want to see you right now. Okay, Vivian Guok, I saw you already. Hello, Vivian Guok. Okay, so what is our our answer already given out. Now we stay for 1 more minute, okay, for the correct answer. Marcus, you haven't answered yet, you can win a chance to win a physiotherapy session. Hello, Vivian Gok. Yeah, okay. So Marcus has one more position. What's the best position to sleep?
Again?
Feng, what is the best position to sleep? Would you want to try to answer?
Okay. Like what I show you just now, there's a photo in the slide. So if you're having any back pain or any sciatica, it's best when you're sleeping facing up, you put pillow underneath. Okay. So you put pillow underneath both of your knees. Yes, it helps to reduce the tension at your back and your leg. And then if you're sleeping sideways, you put one pillow between both of your leg.
Yes, and Marcus, if you have baby inside your tummy, then I think lying down on the side will be best for you, Marcus. I just watched. Okay. All right. So okay, thank you, Feng. Yes. Proceed.
For pregnant lady, so you cannot lie down face up more than 10 minutes during the last third trimester.
Yes, because of the baby head is compressing.
Yes.
All right. So thank you, Feng. Okay, so just some preview. Next week we're going to have another interesting speakers. We are going to talk about lactation. All right, mummies, or you have friends who are just newly mummies. Okay, tag them. Okay, because we're going to give away some homemade soup, homemade soap, body soap, and some lactation supplements. Okay, we will have a very great speaker from a great company. All right, so stay tuned with us next week, next Saturday, 4 o'clock, everybody. Okay, thank you, Feng, again.
Thank you. Sorry for the bad connection.
Yeah, okay, Marcus, no baby inside. Okay, try to go and make the baby inside, Marcus. Okay, thanks. Okay, bye-bye.
Bye.